then umbilical cord. Umbilical cord, how it is formed? Can you remember connective stalk? There is connective. Can you remember connective stalk? A mesodermal stalk, connective stalk. That is a portion of the what's portion? Extraembryonic mesodermal portion connection with the fetus near the region of the future umbilicus. That is called connective stalk. From this connective stalk there is umbilical basal vein, and ultimately with the corporation of the yolk sac, the umbilical cord is formed. So you should know how the umbilical cord is formed. Basic is connective stalk. Connective stalk incorporated with the yolk sac, and then from the it is connected in between the placenta and the placenta means extraembryonic mesoderm and the fetus. So it is future. It is attached to the fetus, to the future region of the umbilicus. Just I memorize a reflection. How actually I am giving a reflection. Not to be serious, though it is complicated. It is some complicated. But I think you can understand partly. What do you say? Can you understand? Something partly, just a vision of the actually the implantation, how the fetus is formed, how the placenta is formed, and you should know, otherwise you cannot follow up the future classes. Just a basic conception and memorization. Already it is a chapter of the embryology. Okay? Any question up to this? Any question of you? So now there is another very important, that is preconceptional counseling. When an woman will be pregnant, that is called preconceptional counseling. What is pre? What is pre? Pre means before. So conception, before conception. So before conception, what do you think? Any care needed? Any counseling needed? Any health checkup needed? Why needed? Why it is needed? You see that in early pregnancy, what we see? There is abortion. There is after that some congenital anomalies, and we see recurrent abortion, and we see the diabetes, if the mother is diabetes, if the mother is anemic, if the mother is hypothyroid, if the mother is epilepsy, and other so many metabolic disorder. It can affect the fetus. So preconceptional period is so important for counseling and to check up and to screening of the diseases, so that the pregnancy period is what? Normal, smooth, and we try to prevent complication of the pregnancy. You see the anemia of pregnancy. Anemia in pregnancy in our country, more than 60% mother is anemic. It varies from region to region, urban, rural, region to region. Sometimes it is near 70%. Incidence is so high. And anemia affects the fetus and also mother. There is another big chapter. You see the diabetes is so common, diabetes. So diabetes complication to the fetus and the mother. What complication of the fetus? Congenital anomalies, small pot death, macrosomic babies, stillbirth, IUD, like this. Epilepsy, also epilepsy drug can affect the mother, and hypothyroid also affect the mother. So we should screening of some diseases before conception. This should give an idea. There is a preconceptional period before from conception before 3 weeks before 3 months up to and later 3 months. This is preconceptional period. Before 3 months, suppose one mother is taking oral pill, she should stop the oral pill before 3 months. Why? It is related with some, there is some adverse effects of the oral pill. There may be congenital anomalies to the fetus or placenta formation not well formed. So, any drug that is affect the mother should stop before 3 months of the conception. And we screening all the diseases. Suppose he had bad obstetrical history, so we should screen the TORS, the TORS antibody, anti-D, anti-G, and G and M. The antibody G and M. The recent infection IgM, immunoglobulin M, and another the chronic infection there is immunoglobulin G. So IgG and IgM for TORCH we do easily. If there is bad obstetrical history, recurrent abortion or recurrent IUD like this. If diabetes mellitus, we also the screening test for diabetes mellitus. So many. And we are not only screening, we should also correct this. After correction, we can give and show to the mother, now you are healthy to become a mother and you can conceive now. You try to conceive now to reduce all this complication. That is called prenatal care or preconceptional counseling. Okay? Now after that, she should be pregnant. There is a period, which period usually mother conceive? Ovulation period. So ovulation period, can you calculate the ovulation period? 14 days before the last menstruation if the cycle is regular. So you can calculate the period. There is some theory that can you give assurance that baby may be female or male? Usually there is some belief that if in the later part of the conception, then it is male, later part, or earlier part in the female. But it is not scientific explanation. There is some scientific explanation, but it is not always correct. Anyway, that is something to talk with the mother, so that she can be affluent, that is, she can get interested. And any food can affect the prenatal period, any food. Folic acid. Folic acid, the folic acid? Folic acid can prevent the congenital anemias, neuron defects, anencephaly, like this. So we can sometimes we can give the zinc also. Sometimes we give iodine deficiency. Some area there is iodine deficiency, so we can supplement iodine also. We can correct the anemia also. So folic acid, especially regarding folic acid, it is asked to give at least before 3 months to prevent congenital anomalies. This question always asked. Why folic acid is given? It is given to reduce the anomalies like central cranial system, cranial nervous system, anencephaly and other spina bifida and anterocele, like this. We can reduce this complication. Okay, so preconceptional care. Then possibly then the period we'll discuss the pregnancy. I think Dr. Hassan is interested to discuss about the pregnancy. If she discuss pregnancy, no problem. You can take the pregnancy. And anything? So next chapter will be diagnosis of pregnancy and management of pregnancy. Okay? Better in the combined class, it is better. Any other things? So Wednesday, 5th year, there is exam, okay? So today we discuss, what we discuss? Implantation, formation of the blastocyst, formation of the decidua, formation of the placenta, embryonic period, embryonic period, and then what? Amnion, umbilical cord, umbilical cord, and preconceptional care. You should read all this, okay? And after vacation, I will take exam of this, okay? Thank you.